Welcome everyone to a brand new webinar with Dr. Philip Miller from Gotham Plastic Surgery. We are very excited to be here today to talk about a topic that is very important to so many women and obviously all of you tuning in today. And that is how—
And men.
Oh, you are so right. Did I say women? You're right.
Yes, you
Men
did.
and women. Thank you, Dr. Miller. Everyone is looking for the best options to tighten our neck. None of us want our kids going like this or asking why our necks look different. And Dr. Miller today is going to go through all the options, surgical, non-surgical, to help us all know what we can do to make our necks look as good as possible. So if you don't know Dr. Miller, I hope you are following him on Instagram. I'll pop that link into the chat in a minute. But Dr. Miller is an esteemed double board certified facial plastic surgeon. So what does that mean? It means he exclusively does plastic surgery from the neck up. So he is absolutely an expert, different from a lot of other plastic surgeons that will do breasts and then a butt lift and then a face, and they do a little bit of everything. So Dr. Miller is very specialized in this area. He has been doing this, I don't know, how many years have you been doing neck surgery?
27 years, I think. Oh, my Lord. Dear God.
You still look like you're 21, Dr. Miller.
I doubt that.
But he has a ton of experience. He's written articles. He's been in textbooks. He lectures on these topics. He's been in the news, all over the media. So you are definitely in good hands. And most of all, I can tell you, because I work with Dr. Miller, that he produces phenomenal results. His patients look very natural looking. They don't always consent to letting us show you the before and after photos, but they are definitely the people out there walking around that you can't tell they had anything done because they look fabulous and natural. Also today, for tuning in, we have a little promotion for you. So make sure to stay tuned until the end and I will explain it all more. So without further ado, Dr. Miller, the floor is yours.
Risa, thank you so very much. I appreciate it. And welcome everyone. Thank you so much for spending this evening with me. I love doing this, these kind of discussions and conversations. Let me go ahead and get started again. Risa, if you just wouldn't mind making sure and just letting me know if I did this properly. It should work smoothly, but again, let me know if it doesn't.
Absolutely. It looks perfect.
Great. Okay, so we're going to talk tonight about refreshing your neck. Again, I want to thank April, who is my social media person and video media PowerPoint expert who's helped me put this together, and my whole crew and staff, Tanya and Zane and Jose and Clay and Adina and Carmen and everyone who's there to help. It really is, I'm so grateful for them to help me put everything together, because we're really a team here and we provide, I think, excellent care as a team. It's certainly not just me. And even though I silenced my phone, for some reason, my watch keeps going off, so I apologize. So we're going to talk about the neck tonight, and we're going to talk about 3 procedures that I really love. One of them is the MicroLift neck. The second is MyEllevate, and the third is the deep plane neck contouring. Now, the MicroLift neck is one of 3 different types of MicroLift procedures that I perform, and let me explain where the neck portion falls in this.
The early signs of jowling and drooping in this region, you may be a candidate for the MicroLift. Now, the MicroLift has several different versions. There's a MicroLift face. That's where an incision is placed here in the temples, and I'm able to elevate the deeper layer, not the superficial layer. No, this is a real SMAS lift, small little incision under local anesthesia, and I'm able to do the MicroLift face. Now, that treats many patients, but some patients still want a little bit more definition on the jaw. For that, I'm going to put a little incision behind the ear. I come around and I grab the jaw and pull it backwards or up a little bit. That gives you a really nice jawline, some banding in their neck and some sagging and laxity in their neck area. I go through the exact same incision in the back of the ear. I reach down instead of forward. I'll come down, grab the soft tissue of the neck and pull it up and back and rejuvenate that neck. So MicroLift is the face, the jaw, the neck, using a single finger here, and your thumb over here. If you're seeing—
Exactly. And that gives you an idea of what the MicroLift, sort of where the MicroLift neck falls in the MicroLift categories. We're working obviously just on the neck region. And here is a really nice example of someone who just had the MicroLift neck. I'll get into the details in just a moment, but here's someone who literally just had the procedure, and I'm sharing the results with you right on the table.
Neck on Susan. Remember, she had fullness in the neck over here, a lot of crepe-like skin over here. She wanted the procedure to be done as we do the MicroLift neck under local anesthesia and no drains. Lifted up everything. Here she is literally right after the surgery. How was it?
It was unbelievable. You have to come and do this. This is the best thing. I feel great. Don't feel drugged. I feel completely like I could walk out of here.
I do give you a little something just to take the edge off.
Relax, but felt nothing, and I'm ready to go home.
And all this skin is elevated up and back, and it's put in behind the ear, and we sort of use this special kind of tissue glue to put everything nice and down here so it's taut and tight, and we hit everything with a small little incision that goes from behind the ear to here. That's it. That's a little marking, that's all. And she's a little swollen, there's no doubt. Okay. And honest opinion, you don't have to act for the camera.
Oh my God.
We can hide the promotion here, but what I wanted to stress was that the incision is behind the ear, and then from that hidden incision, I'm able to come down and grab the neck tissue and pull it not only back, but also up and hide it in a crevasse. It's an actual little incision I make behind the ear, deep tissue, so that when I tie the knot back there, you will never feel it because it's hidden in and deep to the tissue behind
With our
the ear.
MicroLift.
You can get really nice results in very thin-skinned individuals. That's when I really like it, when you have very, very thin, beautiful skin and you get this really nice elevation. But I'm using a new device in particular that I just love, and it enables me not only to grab the tissue in the front or sort of to the side, but it allows me now to grab the muscle all the way in the midline and pull it back to treat all the banding.
This new device, which through the small incision here goes all the way down, grabs the tissue in the middle and pulls up.
What I'm doing here is by that device is allowing me to put a suture right in the middle, and then I take the device out, but you've got a suture now that's connected to and a permanent suture to that effect that is connected to the muscle, so that when I pull that suture back, it pulls the bands all the way back and pulls the muscle up, so you get a really, really beautiful lift. You can see that kind of vertical lift depicted here. This is the individual who's pre-op. You can see that they've got 3 different little freckles, right? Here they are the moment right after the surgery. Take a look how the vertical lift that is. And then the patient comes back around 1 week later. You can still see a little fullness right behind the ear. I call that the MicroLift Gills. I tell patients that they're going to have a little bit of swelling behind the ears, because, and I'll explain later why I'm able to hide the skin, or that's how I get rid of the extra skin, is by sort of accumulating it behind the ear. But you'll get these little MicroLift gills that go away over a course of a week or 2. But what I want you to stress here is the vertical component of the entire neck. It comes up, and it's just as absolutely
beautiful. We are doing a
beautiful.
MicroLift today with our wonderful patient. Say hello.
Hello.
All right. Now we're doing a little modification because we ordinarily sort of pull up in a particular vector. We're doing a special one today because we want to pull up in a little bit different of a vector so that we address the area right here. Small incision right here that's hidden in her hair. I was able to go all the way down here and grab that area. Now watch when I pull.
Now, what I'm talking about here is that, again, I use that other device. Now, previously, I used that device to go from here all the way down and grab the neck and then come back. But in this particular case, this individual wanted me to address a portion a little bit higher. And so I used that same device, but through a different incision, in order to come down almost here without just through that small incision. And look at the effect that I get.
On this string, look at that. I get this whole movement over here to give her the kind of definition that she wants right up over there.
And keep in mind, again, this is a permanent suture. This is not a thread lift. This is a permanent suture that will, in fact, last. Now, what do I do with all that extra skin? Where does it go? How do I contend with it?
Well, the first thing is, hey, I can't do it for everybody, right? I mean, it's really for individuals who have little skin excess or moderate skin excess, depending upon the quality of the skin. And it's not for someone who has a really, really big hanging neck or really, really big hanging jowls. But now, if you are a candidate, what am I doing? Well, I'm relying on 2 natural phenomena that occur. One of them is the fact that skin behind your ear and elsewhere is naturally kind of under stretch, if you will. And just like a rubber band that's pulled, and if you release it, it contracts. And if it's connected to anything, as it contracts, it pulls on whatever it's connected to. So too, if I release the skin behind the ear, it contracts up and it pulls the extra skin along with it, flattening that extra skin. But the second natural phenomenon that I'm taking advantage of is the fact that skin naturally conforms when there's no...
And I'm stopping myself here because I really don't think that I explained this very well, although I'll let it advance a little bit so I don't look as bad when I pause myself. And I really think what I was just trying to say here was simply that as you allow, when you're actually treating the neck, you're tightening it, and so you're increasing the surface area. And by increasing the surface area of the neck, by actually pulling back on the muscle, you need more skin to contour the greater surface area. And that in and of itself needs more skin. And that's where that extra skin goes to, the increased surface area. Will you feel the suture behind your ears? No. As I mentioned, what I'll do is make a little incision through the incision, and I hide and bury the sutures in that region, in that domain, so that you don't feel the sutures. Now, can I do other combinations with the MicroLift procedure? Absolutely. I do the MicroLift jaw. You sort of saw that in the beginning. Here's a nice example of doing it on the
same
table.
principle, small little incision. Instead of placed in the hairline, I'm placing it behind the ear and then grabbing some tissue, and you can see the kind of mobility here that I'm getting. And in so doing, really defining the jawline, the angle of the jaw, getting rid of those jowls over here, and defining the
So the neck would be pulling up in this direction and up here, but that doesn't necessarily mean that you're getting a pull along the jawline here. So the MicroLift jaw allows me to do that. You can see the kind of changes that we can get here before and after, the kind of really nice contour that you can get by adding the jaw lift, the MicroLift jaw. Now, again, the MicroLift is not a thread lift. Let me explain what a thread lift is so that you don't get confused.
A thread lift is this. You've got little barbs on something, you put it in, grab the tissue, and then the barbs on the top go in the opposite direction and sort of hook on. It's like a hanger, right? Except that what's holding the pants on the bottom, these barbs, well, they can easily just sort of fall down. That same thing, that can sort of fall apart. In a MicroLift, it's a true SMAS lift. A SMAS is a fibromuscular tissue beneath the skin that can absorb tension much more so than the elastic skin. So a small incision is placed either in the hairline here or behind the ear, and I put a permanent suture that I use to keep all...
Yeah, we know that. We've already heard you say that, Dr. Miller. Okay, moving on to MyEllevate. Now, MyEllevate is another wonderful solution that has really drastic results, but it's a little bit different because what it's doing is taking a suture, as I described. It's a suture that's going, starting in the middle of the face. It's going to one side of the face, and then it's looping around to the other side of the face, and then coming back and being tied in the middle. This individual has a really, really impressive result, no doubt, but I want to be honest. I want to be completely transparent. This individual also had a chin implant. This individual also had submental liposuction and the MyEllevate device. Okay, and the MyEllevate, again, it's going to pull up on skin that it's hanging a little bit. It's not going to take any skin out. It's not going to really reposition the skin the way the MicroLift neck will do. And yet you will still get some really nice contours. Again, it's done in conjunction with liposuction. So we can do a little liposuction to take out that extra fat and then tighten up. And I do a nice job explaining the difference between the MicroLift and the MyEllevate.
Whether or not it should get MyEllevate or they should get a MicroLift neck. If you buy a pair of pants and you think it looks pretty good, but it's a little too big, and you have to wear a belt, right? Then that's all you really need. The pants are too big and you put on the belt and it's going to cause all this extra material everywhere. It really doesn't look good. You need an alteration. You need to actually open up the seams and close it up and make it look really, really form-fitting. And that's a good analogy. The MyEllevate is a string suspension that goes from here to here to here and sort of pulls and tucks up everything. It does a great job if you don't have a lot of extra skin, if you don't have a lot of sagging, And if you don't have any of those bands, not too much bands, like needing an alteration, MicroLift neck, that's great for patients who have some more extra skin that they want to get rid of, and all I do is sort of hide it behind your ear. Or if overall there's just a lot more hanging and sagging, the MicroLift neck is the right thing for you to do. All right? I hope that answers whether or not you
So
get.
what I'm really saying there is that if you have just need a little tightening, the MyEllevate device works really, really well. If on the other hand, there's a lot of extra skin, then a belt won't work with MyEllevate. What you really need is an alteration. You need the kind of more specific contouring that the MicroLift neck will provide. Talking about specific contouring, we're now moving to the third, more aggressive technique called deep plane neck contouring. Now, you may have heard of a neck lift, and I don't really like the term neck because while the MicroLift neck does just that, it lifts, that's all it's doing. Some patients need more than that. They actually need contouring. And I'm not just contouring the superficial layers of the neck, I'm contouring the deeper sections of the neck, the deeper soft tissue, the deeper fat, and some other components as well. And for those individuals who have a lot of extra skin, who have some excess muscles where their submandibular gland that is showing, and that's what I wanted to point out here. There's a gland that sits right over here. It's called the submandibular gland. And as you get older, it sort of falls down, it gets larger, it falls down, and it causes a bulge right down here. Now you have other glands, the sublingual gland, you have your parotid gland. So in removing a portion, not the entire, but a portion of the gland that's responsible, the submandibular gland that's responsible for giving that altered neck appearance, you are not sacrificing your ability to create saliva at all. You still have plenty of other glands, but this is the gland that I'm going after. And you can see that someone like this, who has a lot of extra fullness underneath the neck, you can see the gland is falling down over here. There's no way I'm going to give her a really nice contour with a MyEllevate or with a MicroLift neck technique. This is an individual who wants a nice, sharp neck. We're going to have to proceed by doing a neck contouring procedure, a deep neck lift, going deeper to the muscle in order to achieve that result by removing the deeper fat, the submandibular gland, the fascia, and even shaving some of certain muscles, not all the muscles, but in order to do that. Again, an individual has crepe-like skin. You can see the platysma muscle has fallen here, and like a curtain, sort of a curtain that is bowing forward, that's what's happening when you get these bands in the neck. The bands are attached in the midline, and then they sort of bow out before they turn upwards back towards the back portion or towards your ear. So I have to pull those areas back, but at the same time, I have to clean out what's beneath them so that I can give you a really nice, cleaned out, almost right angle type appearance in the neck. And that would be a deep neck contouring treatment, as you can see here. I wanted to be quick tonight because I know that there might be some questions, but I want to end with this. We really want to let everyone know that we have gotten a lot of calls about scams. So I want everyone to see, this is my Facebook page. Okay, and if you can see, it's got my name and it has no handle, right? There's no at Dr. Philip Miller over here. Whereas this is my Instagram account, and here you see at Dr. Philip Miller. Okay, and this is my typical Instagram. There's my at Dr. Philip Miller. But there are lots of people, and here's one in particular, who is making a Facebook page and putting my handle on it. And as you can see, there is no handle. There's no at sign on Facebook. And this person somehow figured out, instead of putting a subtitle over here like this, they put a subtitle at Dr. Philip Miller. And they are getting people, believe it or not, they are getting people to give $500, $1,000 to $3,000 to sign up for a consultation or to book surgery. And then the patients, those clients, will call us to confirm that we received their money or whatever. And we've never heard from them because we're not this individual. And it's just tragic. So please, 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 contact us directly or if you do contact us by email or by Instagram, then confirm with a direct phone call, 212-750-7100. We'll put it down. Please, please do not fall, not only for scams in our domain like this, but in any domain that you could possibly fall
And
into.
if you enjoyed this video, like it, follow us, and comment down below.
And I had to do that as a video because I always forget how to sign off. No matter how many videos I make, I can never remember those 3 things. So I just figured I'd put it on here at the very end. Please feel free to connect with me on Instagram, Facebook, TikTok, YouTube, you name it. And just go to any of those, follow us. I love teaching. I want to thank again my team who have helped put together this fantastic presentation tonight. And I am so unbelievably grateful to them. I hope you enjoyed it. I wanted to make it quick. I know sometimes there are a lot of questions. I'd rather get to those. If you liked the content, and partly the presentation tonight is to show you a little bit of the content that we produce on our show. I really, really do enjoy it. Oop, my microphone just changed, I think, right?
We can still hear you.
Okay. So by all means, follow us, follow us, follow us.
Awesome. So for everyone to do what Dr. Miller just requested, I just popped links for our Facebook, Instagram, and TikTok into the chats here. So whatever platform you are on, you can follow us. Otherwise, we are now at the best time when everyone here gets the opportunity to ask Dr. Miller directly any questions they might have. So please use the Q&A feature and we'll get through as many as we can. All right, so this first question, it says, how long does it last? I am not quite sure which procedure they are referring to. Maybe you could talk about how long each of the different ones last.
Yeah,
No, the
it's a great-
MicroLift.
Yeah, it's a great question. And I want to, first of all, define what does it mean by last? That's a really important question. And what I'm going to answer is the following. It is, when do I find patients are coming back and requesting a second procedure? Okay, because when they come back and request a second procedure, they still look so much better than what they did when I first operated on them. But I'm finding that, okay, they're now coming back and wanting a procedure when? Well, for the MicroLift procedures at around 5 years, for the deep neck procedures around 10 or 11 years, and for the MyEllevate procedures around 3 or 4 years.
That's really helpful. Thank you. All right. How about Ulthera? Do you have any thoughts about Ulthera?
Oh, yeah. Okay. So all of those, I'm going to be just totally honest about you. And I have all therapy, and we offer all therapy. We offer lots of other non-invasive techniques, but I wanted to stress the surgical ones tonight. Here's the truth, right? All of those other techniques are pretty good. They're not great. They're not going to last 5 years. They're going to be maybe a year or two, right? And the truth is, they make doing my surgery, they make doing my work harder and harder and harder. Now, there's a collection of around 2,500 plastic surgeons, facial plastic surgeons from around the world that communicate on a forum. And we've been talking for a while now whether or not we should come out and basically say, and we don't want to do it because we know we'd be going up against industry and they've got a lot more money than us. But we almost want to come up and say, you know what, for all of you who are going out and getting these more non-invasive techniques like the Ulthera and others. And again, I offer it and there is some value in that. But patients should know more often than not, you're going to see yourself heading towards surgery anyway, and you're making the surgical procedure a lot more difficult for us. And it's a lot more complicated. And I'd almost go so far as to question whether or not you're getting the best result as well that you could get if you had avoided those other non-invasive techniques and gone straight to non-invasive surgical procedures like the MicroLift first, rather than trying to do those energy-based procedures. Now, that's just an opinion. Lots of other people may disagree. That's fine. But in my surgical hands, I'm finding that it's a lot more difficult to operate on those energy-based tissue than it is if I'm in virgin, healthy tissue.
Wow, that's really interesting. Thank you for explaining that. And you're right. I guess if you're going to invest and you're going to do it, why not do it kind of right from the beginning, right?
Yeah. I mean, I think it's because, and it's understandable. I mean, just to be clear here, right? I do a lot of MicroLifts and a lot of MicroLift faces on individuals who would benefit from a deep neck contouring technique. So am I being sort of a hypocrite telling you, hey, if I'm doing the more minor procedure on someone who's going to want a more major procedure down the road, why would I do that? Why not just encourage them to get the more major procedure? And the answer is because the more minor procedure isn't interfering at all with the results or the surgery of the more major procedure down the road, whereas the energy-based procedures are.
Understood. All right. How about doing these procedures on skin of color? Do you have experience treating people with skin of color?
Yes, as you may have seen in one of the procedures here, I do, and I've never had any issues really at all. There's really not much to discuss about that. The incision, as I mentioned, are hidden behind the ear, or in the case of MyEllevate, I'm making small little holes underneath the neck and in behind the ear, or in the case of the deep neck lift, again, it's an incision under here that's very well hidden and behind. I try to make it so that there's no tension at all on the incision line. That's when, in doing it's where you put tension that you start getting the risk of hypertrophic scarring, keloid scarring, and the like. So if there's no tension, there rarely is any consequence.
So I think you may have just answered this question. They said, I've seen patients after a regular facelift develop a white discoloration around the incision. Can this happen with a MicroLift neck incision behind the ear?
Well, yes, but if it does, then it's unlikely that you would ever see it, because where the incision is behind the ear from here to here. Now, there are some, in a perfect world, everything falls into perfect categories. But the truth is, people come in of varying pathologies. And so have I done a MicroLift procedure where I've extended the incision, not just behind the ear, but towards the hairline and back? Yes, because they didn't want anything else. All they wanted was the MicroLift, but they had so much extra skin. The only way to treat them was by cutting some of the skin out. And in that response, in that particular case, I had to extend the incision so that it did cross over behind the ear into the hairline and then down on the hair itself. So I really do treat every single patient as a unique individual and tailor the results towards them. I designed the whole MicroLift process for younger individuals. And what I find so amazing is older individuals are coming to me saying, I don't want the more invasive technique. I'll take whatever the micro gives me. And it does a pretty darn good job. It really does. So I'm getting more and more experience and more results on doing it on individuals who I would otherwise have recognized, otherwise I would have suggested getting a more deep neck lift.
Got it. And so when you're doing the micro neck lift, if there's too much skin behind the ear, you make the call right then and there to trim off the excess?
I will often be able to tell before the procedure and when I'm doing the consultation, and I'll get the patient's permission. I don't do it without their permission, because there's a big difference between making an incision and promising you an incision behind the ear versus doing an incision that goes behind the ear into the hairline and back. Now, let me be clear. I hate bait and switches, right? I don't like doing that, not at all. So the MicroLift, if you come in and you're like, hey, I want a MicroLift, and I only want you to put an incision behind the ear, I will do that. And I'll be honest to say, okay, well, you may not get this result, because if I do this real tight result on you, I'm going to have too much skin over here. So which do you, the patient, which do you want? Do you want me to get the best result possible on the neck, but then I have to make a bigger incision here? Or do you want me to keep the incision small, and then the compromise comes with the kind of definition that you have in the neck? Now, all the results that I showed you tonight were incisions that were just behind the ear.
Got it. That makes sense. So at what age in general would you say it's better to go with the deep plain neck lift versus a micro lift, or is it just really dependent on the patient?
It's really dependent. That's what I find so fascinating, is that patients who I would otherwise claim or would otherwise suggest getting more involved procedures, they're coming in saying, I don't want it. But let me answer your question, Risa. And I was just asked that question today by a patient, which is, hey, you know, when do I, and I'm changing subjects a little bit, but they asked, when do I know if I'm a candidate for a deep plane facelift as opposed to like a MicroLift, whether it's a MicroLift neck or a MicroLift face? And my answer is very simple. You know, if you can take a single finger and pull back and you like the result, that's a MicroLift face. If you can take a single finger and pull back on your neck, and you like the way it looks, that's a MicroLift neck. If, on the other hand, after pulling back, you look on the side view and go, oh, you know what? I'm still really full underneath here. I still don't get the kind of contour I want. Then, while you're certainly a candidate for the MicroLift neck or the MyEllevate, you're going to get a better result if you proceed with a deep neck lift. Or in terms of the face, if we do this and you're not particularly happy and you have to use more than one finger, you're using 3 fingers to get the result, then you're really a candidate for a deep plane facelift. And I'm trying to stay focused on the neck because that's what the topic is tonight. But there are other subtle signs that we could talk about for the face.
So when someone comes in to see you for a consultation, this is the kind of discussion you're having. You're touching, pulling, and kind of showing them all the options because, of course, you offer all of them, and then you work with them together to determine the best plan.
Correct. But I just want to I do want to just temper or change one word that you said there, which is when they come in. I would say 50% of my consultations now, Risa, are online. I'm very fortunate and lucky. I'm very grateful to have a national and international practice. Probably, I think every Friday now, we haven't been doing it, but every Friday, I want to come out and have Clay, who's my patient coordinator, who's fantastic, sort of announce who is the farthest patient interviewed. And I wonder who it would be this week, but I know last week the patient was from Indonesia, and she's actually, and I saw her again this week because she's coming in for surgery in a couple of weeks. So I'm fortunate enough to have national and international practice. You don't need to come to the office. We can do a lot of this online. My staff helps you send in appropriate photographs so I can do the analysis on the photographs, but more importantly, on a Zoom, I'll have you raise up different portions of your face. An individual she was from California today. She from LA? Yeah, it was an individual from LA who I did a consultation on today, very heavy neck, and did a consultation for the MicroLift neck. And I was, just like I had told you right now, I said, okay, great. Take your thumbs and pull it back like that. Do you like the way that looks? And she said, yes. I said, do you still feel that there's a lot of fullness in that area? And she did. She had a very full neck. And she said, yes. I said, well, then right there, what you're seeing is the result of a MicroLift neck. If you want more than that, that's going to be a deep neck lift, a deep contouring.
Oh, wait, you just cut out. Your audio just cut out 1 second ago. No, that was so strange. It was like mid-sentence. All right. Well, while we are looking at that, you guys have some great questions in here we will get to momentarily. And I know not all of them are on the neck, but we'll get to as many as we can. I see someone saying they'll see us in NOLA next. Does that mean you come see us? Let's see.
Say that again?
Oh, we hear you now.
Yeah.
Okay.
Sorry about that. Yeah, I'm trying to find out. You know what happens? I think I touched my really nice. Did I mute this or something? Go ahead.
Oh, the nice mic. All right, this is like an A/B test of the nice mic, but that's okay. All we need is you. So,
Thank you.
The MicroLift neck, does that give improvement also to the jawline?
In some patients, yes. Again, what I really love about these procedures is that you get to answer so many of your questions. So if you pull back here and you find that you get a really nice improvement in the contour of your jawline, then yes, it will. Other individuals won't. It does have something to do with the angle. So some jawlines go down more like this. Other jawlines relative to the angle go more forward. So the more down, not as much. The more forward, yes, absolutely.
And what's the recovery time typically like for a MicroLift neck? And is it a dressing that's applying and worn during recovery like a normal facelift?
Yeah, the MicroLift neck is around a week, and with my changes, as I'm using those different devices and I'm doing less and less invasive techniques, I would say it went from maybe 2 or 3 weeks because you were getting a lot of swelling to now it's closer to maybe a week, maybe a week and a half. For the MyEllevate, it's around a week, and for the deep neck contouring, I would put it closer to 2 weeks before you feel a little bit more
Yeah.
like the swelling has gone away. Now, in all cases, this is very important. In all cases, you will be more presentable than you feel like you will be presentable. Okay, you'll be much more self-conscious. You'll be walking around a little bit more like this, like, oh, can I turn to the left or can I turn to the right? You will feel like you are, it's very obvious that you had surgery, and yet anyone who looks at you will think you look terrific, especially if going to our female patients now as opposed to our male patients. Our female patients can wear the hair down a little bit and hide any swelling behind the ears that may still persist. The men, yeah, you have a little bit longer recovery period. Sorry, that's just the way it is.
But that's why we like this winter time, because men can just throw a little turtleneck or a scarf around there. Easy.
So true. So true.
All right. So we have someone here. She said, I think she's giving us a little testimonial. She said, for my procedure, I did a Zoom and then did an in-person, and it was a great experience. I'm joining today to pose a few questions that I thought might be helpful for others. I'm so excited.
Great. Oh, that's very great. Thank you very much. I'm sorry, I don't have access to those, or I don't even want to, I'm too
Oh,
scared.
I
about
guess I can
clicking
say her
on-
name. It's Jen from Las Vegas.
Oh, hey, Jen, how are you? Thank you so much for, that's so sweet of you to chime in, Jen.
Yes,
Thank
thank
you.
you so much. All right. So, do any of these procedures, like moving the platysmal bands, affect any of your voice or speaking? Is that a concern?
No, not at all. Your speech will not have any effect at all. You'll feel a little tight. You know, I always joke, I joke, you may not think it's a joke, but patients say, you know, Dr. Miller, I feel really tight in my neck. And I said, yes, that's what you paid for. Okay, you want to be tight, but obviously, no, it won't affect your speech. Obviously not. That would be a bad thing.
Okay, so this is a little off neck, but still related. So can a MicroLift help your eyebrows lift or open up the eye area from lifting the side areas at all?
Great question. Now we're, just so that people are aware, we're talking now about the MicroLift face, not the MicroLift neck. And it depends upon the individual. There are some patients who, to get the change that they want in their eye with one finger, lose the advantage that they want to attain in their face. And there are other individuals who, in raising up where they want improvements in their face, get improvements in their eye. Those individuals get a 2-for-1, right? They're going to get the benefit of both. The other ones, they won't. And you'll be able to assess that yourself. Now, if you're doing this, if you're going, well, yeah, I do get it, but I have to use one finger over here and one finger over here, well, then that's sort of a MicroLift brow and a MicroLift face. So it's two different incisions. Sometimes it's one incision, but then I have to do two different vectors. Again, we work with the patients. And again, I love the fact that the MicroLift is something you can make the assessment yourself. All you have to do is stand in front of the mirror. You want to know what it's going to do for you. Finger on between the ear and the eyes, right in the middle. You pull up and back. If you want to get an idea about the neck, use your thumb, pull it forward. Go from the front and pull towards the back. That's your MicroLift neck. And if you want to get an idea about MicroLift jaw, just use your other fingers and pull over here. Not everybody needs the jaw. The jaw itself, the MicroLift jaw, is very, very, very infrequently done as a separate procedure. It's typically done in conjunction with the MicroLift face or the MicroLift neck, because most of the time to do it alone creates too much bunching of the tissue here, and you need to have it done in conjunction with the other techniques.
Got it. And so what if someone has some excess fat down here? Will you incorporate another procedure in with it?
Where, I'm sorry, I didn't see you.
Oh, sorry, in the neck, in their neck.
Yeah. Oh, if you're having excess fat in here, then we can do something as simple as a liposuction. And that usually can get rid of it. But again, I'll try to do the assessment for you. I want to find out. Remember, the liposuction can only be performed on the fat that is superficial to the muscle called the platysma. That is a hammock going from one side to the other side. Okay, that's a hammock. And the fat that's superficial to that can get liposuctioned out. but a lot of times there's fat deep to that. And that fat deep to that, which is a combination of fat as well as deep, rich lymphatic tissue, that can't be liposuctioned out. That has to be directly identified and contoured and resected out carefully. And that's where the deep neck comes in.
Interesting. So will the MicroLift face or jaw distort your smile at all? And since the patient's partially awake during the procedure, are you able to test that before you tie the sutures?
Yeah, no, it does not distort your smile, and it's simply because it's not that powerful, right? A deep plane facelift really does a lot, right? You can do a lot with the corner of your mouth with your 5 fingers here, right? That's going to resemble a deep plane facelift. You have 1 finger and you pull it up over here, or you pull it up over here, you really don't have any change on your mouth, so you have no effect on the mouth. We would never want to pull the mouth under any circumstances going back. It would always want to be going up, by the way.
Got it. How long do you have to wait after a revision, deep plane face and neck lift? How long do you have to wait to do
how
a
long
revision?
after a deep plane facelift do you have to wait for a revision?
How long do you have to wait to do a revision, deep plane face and neck lift?
Yeah, so I'll answer. I think there are a couple of questions.
Okay.
How long after a facelift do you want to wait for a revision, and the revision being a deep plane facelift? And I would typically say around a year. And the reason is operating shorter than a year is the scar tissue is immature. It bleeds a lot. It's now I'm granted, assuming there's no complication. If there's a complication, sometimes you go in sooner. But assuming you just may not like the result, I typically like to wait at least maybe 9 months to a year before I go in again, so that I can get a mature scar tissue. It doesn't bleed as much, and I can have a better visualization of the planes. Now, assuming you had a deep plane facelift, how long do you have to wait? Again, around a year. And I'm surprised at how many of the patients who are coming in now who have had a deep plane facelift, right, who want the MicroLift, whether it be a MicroLift face or MicroLift neck. I was really surprised by that. And it's just that it gives you that much more of an oomph. They've gotten maybe 80% with the deep plane facelift, but they still have a little bit more that the MicroLift, and they don't want to undergo another deep plane facelift. They don't want to undergo that kind of recovery period. They don't want to expose themselves to that kind of risk. So they come in for the face and the MicroLift face and MicroLift neck.
Got it. That's really interesting. And so when you're doing these procedures, are you also sometimes combining injectable fillers or anything else in with it for like a total package? You do it
I
the
have
same
to be
time?
honest with you. I typically, not that I wouldn't, but I'm answering your question as is, which is no, I usually don't, because often they don't need it. When I do a deep plane facelift, I will often combine that with not fillers, but fat injections. Fat typically lasts a lot longer and it's more abundant. So whereas on fillers, you'll be charged on each and every syringe that is used, I want to use fat, which is all natural. I can take a lot of it out. I can use as much as I want. I can process it by adding PRP, like a platelet-rich plasma or platelet-rich fraction. And I can use that to put in the cheeks, in the temples, along the nasolabial folds, in the chin, in the nasolabial folds, in the marionette lines, along the jawline, improve the jawline, etc. So I will use fat for deep plane facelifts or deep neck contouring. But usually when I'm doing the MicroLift face or neck, rarely, typically because patients don't necessarily need it. But I have no objection to it.
Got it. But of course you do offer them in your practice, and it's,
Yes.
part of the full package, I guess.
Yeah.
All right. A lot of people are asking about price. Is there I know everything's custom, but is there anything you can tell?
Oh shoot, where's Zane? Where's not Zane? Where's Clay? Clay when I need him. All right.
Where's Clay when we need him?
Clay, where are you? Hold on a second. And I know, because I know we just.
Well, Zane's watching. Zane, if you want to message
Oh,
in.
Zane, if you can, is Zane watching? Hey,
Yeah.
Zane, what? Maybe he can go ahead and just send us a text or something, because that's not fair to give this whole thing but I know that we just. I know where it is. Hold on a second.
Okay.
Again, I've got all these monitors here, but why don't you go ahead and ask me another question? And
Yes, I will, and I'll try and get an answer at the same time. So, what percentage of the fat stays and remains?
When you do fat injection, I'm going to be perfect. No one can tell you, right? No one can tell you. But fat, there's most people think anywhere between 50 to 100%. So you could argue, well, go ahead and inject 150% because that way, if 50% leaves, you still have 75%, something to that effect. Do the math. But what if it stays? Now you've got 150% of fat that you don't need, right? And it's going to look distorted. So I basically inject what you need, and that's it. I don't take any chances with that. And in my experience, the vast majority, around 80% of it still is there. What does happen, interestingly, is patients always tell me, don't over-inject, don't over-inject. So what happens is they start here, right? They start here, they tell me they only want this, but they swell. So they go through a period where they go up and then down. And what ends up happening is they hit this point right here, still in the swelling point, and they like that. They didn't tell me they wanted that. They told me they wanted this. But they pass through this point where they're swollen and they really like it, but they get to the point where they said they wanted it to be. That's what I find more often than not. And I said, well, you're actually where you said you wanted to be, but I think you wanted more, but you didn't want me to do more. So we'll add a little bit more later. And I can do that either by adding a little bit more fat or by doing a little bit of filler.
Got it. Okay. That is really helpful. So
I think I have it. I think I have it. Hold on.
Oh,
wait. Okay, here it is. So I'm gonna get in trouble if I hear. Hopefully this is right. It's the MicroLift neck, which is also inclusive of sedation, is anywhere between 18 to 21. Again, it all depends what else is going on.
okay. New York City.
Right.
Okay, that is helpful. I hope that helps everyone. But again, everything is so customized. That is something with Dr. Miller. When you meet him, you will see he is going to completely customize a treatment plan for you. So I really encourage you all to book a consultation. And like he said, you can do them virtually, so you can do it from anywhere in the world. So I just popped in the chat a place to book online. There's an option to book
Thank you.
in person.
I do see that. That I can see.
Okay, great. And people are asking, will this webinar be replayed? I missed the beginning. Yes, we recorded it. So we will be sending it out this weekend, and it will live forever on YouTube and on our website. I don't know about forever. That's a big word. Almost forever. So yes, absolutely. And you can always replay it if you miss anything, or if you want to see Dr. Miller's presentation again with all of that good information. So if anyone else has any other final questions, otherwise, I think we got a ton of amazing information today. This was great. You really inspired me specifically. I think there are so many good ways to tighten our neck, and I really appreciate your transparency about using the devices first, even though you sell them in your practice. Can you tell people how often are you in New Orleans?
Oh, yes, I am in New Orleans. I try to be down there 1 week a month. It's been tight recently because I couldn't go down in September because we were in Istanbul. Actually, I was very honored to be speaking at the European Academy of Facial Plastic Surgery, where I spoke about both the MicroLift face and the MicroLift neck. And then we went on a tour afterwards, which was great, hanging out with just this amazing group of international facial plastic surgeons. The tour itself was exhausting, I have to tell you. It really was. Turkey was amazing, but hanging around with individuals from, and I have a great shot on my Instagram. I mean, they were from Colombia and Peru and Malaysia and Indonesia and Egypt and Saudi Arabia and Turkey and France, Belgium. It was amazing having all these wonderful interactions with individuals. But so I wasn't in New Orleans for September, and in October, our academy meeting is at the same time that I was supposed to be down in New Orleans. So I'm only seeing patients and I'm already booked up on that Monday, and I'm already
October
booked up for surgery
21st
Tuesday, Wednesday.
and 24th.
Yes, I think that was the time you were thinking of coming into New York. So and then November, I'll be down around Thanksgiving time. So that's only 3 days there. So I'm down there, but we will try to fit you in please let us know. We'll try to do that. I do have a couple of long-standing New Orleans patients who called because they couldn't fit in October, and I'm basically seeing them after hours. I will make the effort.
But generally about one time a month. I just popped in the link so you guys can see the upcoming dates. Okay, a few more questions have come in. So when do the gills start laying flat? The gills behind the ears after a MicroLift neck, how long till they go down?
Couple of weeks. I mean, again, not everyone has them. And in the newer techniques that I'm doing, I'm finding that I'm not even putting them in. But what are they, by the way? It's two things. One of them is if I'm not choosing to move this, if I'm not choosing to make an incision behind the ear to cut the extra skin out, some of the gills that I call it are simply that extra skin that's accumulated and is just full, and swelling is beneath it, and the swelling takes time to go away and the skin to lie flat. So it's behind your ear, and again, no one can really see it, but you'll feel it with your hand and you'll think that it's huge, but if someone took a picture, you can't see it. And the other possibility is just coming up with the suture over here sometimes causes the parotid gland to swell up a little bit, and over time that parotid gland goes away. So there are a number of reasons why you get it, but typically within 2 weeks or so, it goes away.
Great. So this is a great question. I get Fraxel 2 times a year to help with precancerous sun damage. Would you suggest I do it right before a MicroLift or right after I have mature skin?
I would recommend probably, I'm going to split it right down the middle and go 3 months after and 3 months before. Because I don't want you to get the skin injury to areas that I've just elevated right afterwards. And I don't want to operate on skin that has just been recently traumatized. So if you give me 3 months of healing, you should be fine. And then you get 3 months of healing before you go ahead and get exposed to that again.
Perfect. That sounds perfect. All right. And this one says, what does the device do that you use? Is it just put in the sutures? Is there no device left inside other than the permanent suture?
Yeah, and I think I have, if I go back behind me, I'm probably going to make.
Okay, don't do that.
It's a really, really cool device. I really think it's interesting. So what it does is think of a needle, right? And the needle has the thread going through it. And what the needle does, what the device does is it sucks up tissue, and then it puts the needle through the tissue, right? And then the needle just keeps going until it goes through the receptacle on the end of the device, wherein it inserts the needle, right? But remember, the suture's there, and then the needle gets retracted. But the end device here holds on to both ends of the suture that got passed through, right? Because when you're putting it through the tissue and you're putting it through, you're putting a suture, so you've got both the sort of the beginning and the end of the suture, and this part is holding both of it. So when you pull the device out, you're pulling both ends of the suture out, and then you can sort of justify it at the end and untangle it from the contraption, if you will. But now what you've essentially been able to do is encircle the tissue without actually putting an actual stitch through it, through a circular stitch through it. It's hard to explain, but yes, what you're actually doing is putting a stitch through the tissue, and then the device comes out. You disentangle the suture, which is the string, the surgical string, from the device, and the device gets put down. And now what you're left with is the suture without having to expose this whole area so that I can see it and I can actually put a suture through. Does that make sense, Risa?
I think so. I think so.
Well, I think so means no, but it's unless you actually see it, it's a little complicated to explain.
Okay. I trust you.
Or I should just say
maybe how about on social media we do a little post showing the device, because that probably would help explain.
I do have it. I don't know if I actually have it on how it works. And I should point this out as well. You know, I'm so committed to undergoing more non-invasive techniques that I'm working now with a company that has made a device for laparoscopic surgery. So if you know, laparoscopic surgery allows you to operate in the belly, right, using telescopes and microscopes and all. And it's a device that allows you to sew inside the belly And I've found that device and I'm incorporating that now into the MicroLift. So even though I'm making a small incision over here, I can come all the way across and sew these muscles together and then come back out again without having to elevate anything over here. So I'm working on that as well.
I love
Lots
that.
of innovation.
All right. Okay. I want to be respectful to everyone's time. Shortest question ever. If I get a MicroLift and then later I get a facelift, will those sutures get in the way?
No, they will be there and you'll see them. And then what's nice, particularly with it, you know, you can just cut them and slide them out, or you just leave them alone.
Beautiful. All right. Well, thank you so much, everyone. All right. So we did say that 10 lucky winners would get a complimentary laser genesis. And here's how: you need to be one of the first to book a consultation. So those first 10 to book a consultation with Dr. Miller. Does that sound okay? You didn't know we're giving this away? I know it's a great giveaway.
Are you reading my face?
I'm reading your face.
Yeah,
For everyone-
I leave it to you when it comes to promotions. Whatever you
Okay.
think is right.
I know we're busy and we don't have a lot of room, but we wanted to give back to you all for spending so much time with us today. So the first 10 people to book a consultation with Dr. Miller for any of these neck procedures.
No, I don't think, wait, we just got to be true to whatever we posted. Because if we were going to give the laser genesis, then we should offer the laser genesis independent of the consultation. Otherwise, that's not fair.
Okay. All right.
Whatever we did, you know what I mean? Whatever we offered, we have to honor.
Yes, we just said 10 lucky winners will receive a complimentary laser genesis. So
Well, then I think we should give 10 of these wonderful people
okay.
who've been on here should give them. Now, what the caveat is that we're going to offer it to 10, but if you're not a candidate for it, then we're not obviously going to do it to you, you know. Yeah.
All right. Well, then this is your lucky day, everyone, because that means all of you have a very good chance of getting this. So we will pick 10 lucky winners and let you know in the next couple days. So make sure to follow us on Instagram. And overall, some people are saying amazing. They're going to see you in New Orleans. Thank you so much, everyone, for tuning in. And thank you, Dr. Miller, after a busy day of doing surgery. We are very grateful to have all your time and all this education. It's so helpful just to hear it transparently from a surgeon.
Well, and again, Risa, I can't thank you enough. You make this so easy. You really do. And my team, again, from Tanya to Jose and April and Zane and Clay and Carmen and Adina and I mean everyone involved. And I know I forgot someone, so whoever I did, please forgive me. Allie, who's also been thank you so very much for everyone who just makes my practice run as smoothly. And I will tell you right now, the nicest thing I ever hear is all the compliments everyone gives me on how amazing my staff is. And I really do believe I have the best staff in the world, and they treat my patients like family, and that means the world to me. So Risa, again, thank you so much for taking the time out of your afternoon, because you're on the West Coast, for helping us do this. I really appreciate it.
Perfect. So thank you all so much. And we can't wait to see you in either New York City and Manhattan or New Orleans. Everyone's saying yes, thank you, respect, have a great weekend. And we can't wait to see you all soon. Thank you, Dr. Miller.
All right.
Have a good
Have a
evening,
great night,
everyone.
everyone. We'll see you soon. Bye-bye.
Bye.